A single over-the-counter supplement, something so common you can find it in any grocery store, and yet taken incorrectly, it can lead to kidney failure, breathing difficulties, and even serious heart complications. Today, we're not just talking about magnesium, we're talking about how to use it safely and intelligently. Many of us reach for magnesium, hoping to ease muscle cramps, find a deeper night's sleep, or calm a racing mind. We hear about its benefits from friends, family, or online articles, and for the most part, it can be incredibly helpful. But this is only half the story. The other half, the part that is rarely discussed but is profoundly important, is that the common advice can be misleading, and in some cases, downright dangerous. What we're going to explore together today is the crucial information that gets lost in the headlines. We're going to bypass the surface-level advice and get to the heart of the matter. We'll uncover the vicious cycles that can trap so many of us. We'll expose the hidden depleters that might be in your medicine cabinet right now, and we'll reveal the surprising truth about the tests your doctor might run. But I need you to stay with me until the very end, because the final piece of information we'll share, our vital truth number 1, concerns the 4 groups of people who should never take magnesium without strict medical supervision. This is the information that is absolutely critical for your safety. So, if you're ready to gain a true understanding of this powerful mineral, subscribe and join our community of health-conscious seniors. And just a quick important reminder, all the information shared today is for educational purposes. Everyone's health situation is unique, so please consult your doctor or a qualified healthcare provider before making any significant changes to your regimen, especially if you have pre-existing conditions or are on medication. Our goal here is empowerment through knowledge, so you can have the most informed conversations possible with them. All right, let's begin our journey. Insight number 5, the vicious cycle of stress and magnesium loss. Let's start with a feeling I'm sure we're all familiar with: stress. That feeling of being overwhelmed, anxious, or lying awake at night with your mind refusing to switch off. Have you ever felt that way? It's a universal human experience. But what if I told you that stress doesn't just affect your mind? It physically robs your body of a mineral essential for calmness. This is the cruel irony many people find themselves trapped in. When you're stressed, your body activates its fight-or-flight response. Think of it like your body's internal alarm system going off. To handle this alarm, your body burns through its magnesium stores at an accelerated rate. At the exact same time, stress hormones like cortisol tell your kidneys to get rid of magnesium, flushing it out of your system. So, stress burns up your magnesium, and having low magnesium makes your body less able to cope with stress, which then causes more stress. It's a downward spiral that can feel impossible to escape, leaving you feeling perpetually on edge and exhausted. To truly grasp this, let's use an analogy. Imagine your nervous system is like the electrical wiring in your home. Magnesium acts as the insulation on those wires. It keeps the electrical signals contained, calm, and directed. When you're low on magnesium, it's like that insulation has become frayed and worn out. The wires are overexposed, leading to sparks of anxiety, short circuits of irritability, and power surges that keep you awake at night. Therefore, trying to manage stress without enough magnesium is like trying to fix that faulty wiring while the power is still on. It is not just ineffective, it can make the situation worse. Replenishing your magnesium is like giving your entire nervous system a brand new protective coating, allowing it to function smoothly and calmly. This is why, for many, simply addressing magnesium levels can feel like finding the missing piece of the puzzle for better sleep and a calmer mind. It's not a cure-all, but it provides the essential raw material your body needs to break free from that vicious cycle. Insight number 4. Hidden depleters in your medicine cabinet and lifestyle. Now that we understand how our own bodies can work against us, let's look outside ourselves, specifically into our medicine cabinets and daily habits. It's a jarring reality that some of the very things we do to manage our health can inadvertently be stripping our bodies of this vital mineral. The first group to be aware of are very common medications for high blood pressure, often called diuretics or water pills. Their job is to help your body get rid of excess water and sodium to lower blood pressure, and they are very effective at this, but they are not very selective. As they flush out the water, they often take essential minerals right along with it, and magnesium is chief among them. It's like trying to bail water out of a boat with a leaky bucket. You get the water out, but you lose something valuable in the process. The second culprit is another extremely common category of medication, acid blockers, specifically proton pump inhibitors, or PPIs. You might know them by names like omeprazole or esomeprazole, used for heartburn, acid reflux, or ulcers. They work by reducing the amount of acid in your stomach. However, this introduces another complication. Your body needs that stomach acid to properly break down and absorb magnesium from your food and supplements. So while you might be eating a diet rich in magnesium, your medication could be preventing it from ever reaching your bloodstream. As a result, long-term use of these drugs can slowly and silently lead to a deficiency. Beyond medications, our lifestyle choices play a huge role. Regular alcohol consumption is a significant factor. Alcohol does a double whammy on your magnesium levels. It interferes with its absorption in your gut and simultaneously acts as a diuretic, increasing the amount you lose through urination. Even moderate, consistent drinking can steadily deplete your reserves over time. Finally, for those of us who are active, whether it's playing tennis, gardening intensely, or even working a physically demanding job in a hot climate, we need to think about sweat. When you sweat, you're not just losing water, you're losing electrolytes, including a significant amount of magnesium. Therefore, if you are someone who sweats heavily on a regular basis, you are literally losing this calming mineral through your skin and need to be more mindful about replenishment than someone who is more sedentary. Recognizing these hidden depleters is a crucial step in taking control of your health, ensuring your efforts to stay healthy aren't being unknowingly undermined. Insight number 3. The misleading blood test and the calcium paradox. This next insight is one of the most important on our list because it addresses two of the biggest and most common misconceptions about mineral balance that can lead people astray. The first involves how we even test for magnesium deficiency. If you suspected you were low, you might ask your doctor for a blood test. This seems logical, right? But here's the critical piece of information they don't often tell you. A standard serum magnesium blood test can be deeply misleading. Why? Because only about 1% of your body's total magnesium is actually circulating in your blood. The other 99% is stored deep within your bones, muscles, and cells. Your body is incredibly smart, and it works tirelessly to keep your blood magnesium level stable, viewing it as a top priority. It will actually pull magnesium out of your bones and tissues to maintain that normal blood reading, even if your reserves are dangerously low. This brings us to a powerful analogy. Relying solely on a blood test to determine your magnesium status is like looking at the very tip of an iceberg sticking out of the ocean and trying to guess the size of the massive structure hidden beneath the water. The visible part looks small and stable, but you have no idea if there's a huge solid foundation below or if it's on the verge of collapsing. Therefore, you could have a normal blood test result while your muscles and nerves are literally starving for magnesium. This is why it's so important to listen to your body and pay attention to the classic symptoms: muscle twitching, weakness, anxiety, and poor sleep, rather than relying on a single lab value. The second part of this insight is the delicate dance between calcium and magnesium. For decades, we've been told to take calcium for bone health, and many older adults take calcium supplements dutifully. But taking calcium without adequate magnesium can set you up for a host of difficulties. Calcium and magnesium are partners, but they can also be rivals. Calcium is responsible for muscle contraction, while magnesium is responsible for muscle relaxation. Imagine a light switch. Calcium is the on switch, and magnesium is the off switch. Without enough magnesium, you have a lot of on signals with very few off signals. This can lead to muscle cramps, high blood pressure, as blood vessels can't relax, and heart palpitations. Furthermore, without enough magnesium to direct it, excess calcium doesn't always go to your bones where you want it. Instead, it can be deposited in soft tissues, potentially contributing to issues like kidney stones or the hardening of arteries. A good general rule of thumb health experts often highlight is a ratio of about 2 parts calcium to 1 part magnesium. This balance ensures these two vital minerals work in harmony, not against each other. Key strategy number 2, choosing the right magnesium for the right job. All right, let's say you've listened to your body, recognized some of the signs, and decided with your doctor that a magnesium supplement is a good idea. You walk into the pharmacy and are immediately faced with a wall of options: magnesium oxide, citrate, glycinate, malate. It's confusing. And making the wrong choice can mean the difference between relief and, well, a lot of time spent in the bathroom. It's a well-regarded principle that not all forms of magnesium are created equal. The most common and cheapest form you'll see is magnesium oxide. Many people buy it without a second thought. However, you need to know that magnesium oxide is very poorly absorbed by the body. It acts more like a laxative than a nutritional supplement. To make sense of this, let's use an analogy. Think of these different forms of magnesium as different types of keys designed for different locks in your body. Magnesium oxide is like a blunt, poorly cut key. It can't really get into the cellular locks, where it's needed for energy or nerve function. Its main effect is simply irritating the door of your digestive system, causing things to move along quickly. This is why it can be effective for constipation, but it's not the key you want for addressing a systemic deficiency. Now, let's talk about the master keys. Forms like magnesium glycinate and magnesium malate are what we call chelated. This simply means the magnesium is bonded to an amino acid. This bonding process creates a key that fits perfectly into your body's locks. It allows the magnesium to be carried easily across the intestinal wall and into your bloodstream, where it can travel to your muscles, brain, and heart. Magnesium glycinate is often called the calming magnesium. The amino acid glycine itself has relaxing properties, making this form an excellent choice for improving sleep, reducing anxiety, and easing muscle tension without the laxative effect. Magnesium malate is often referred to as the energizing magnesium, as malic acid is a key component in your cell's energy production cycles. So when starting out, the best strategy is to begin with a low dose, around 100 milligrams daily, of a highly absorbable form like glycinate or malate. Always take it with a meal, preferably one that contains some healthy fats, to improve absorption and prevent any stomach upset. Splitting your dose between morning and evening can also enhance absorption. Remember, the goal isn't to shock your system, but to gently and consistently replenish its stores. The vital truth number 1, the 4 red flags, when magnesium is dangerous. We have arrived at the most important part of our discussion. We've talked about all the potential benefits, but now we must talk about the risks, because for some people, taking a magnesium supplement isn't just unhelpful, it can be incredibly dangerous. This is the vital truth that I promised you, and it's centered around 4 critical red flags. The first and most critical red flag is kidney health. This is non-negotiable. Your kidneys are the primary gatekeepers for magnesium levels in your body. They are responsible for filtering out any excess and removing it from your system. If your kidneys are not working at full capacity, whether from mild kidney disease or complete kidney failure, they lose the ability to perform this crucial task. Let's use a clear analogy here. Imagine your body's magnesium level is the water in a bathtub. The faucet is the magnesium you take in and the drain is your kidneys. In a healthy person, if the faucet is on a little too high, the drain easily handles the excess and the tub never overflows. But if you have any kidney-related health concerns, it's like the drain is partially or completely clogged. Even a small, steady drip from the faucet will eventually cause the water level to rise, and before you know it, the tub overflows, causing a dangerous flood. This flood in the body is a condition called hypermagnesemia, toxic levels of magnesium in the blood. Early signs might be nausea or fatigue, but it can quickly progress to muscle weakness, dangerously low blood pressure, difficulty breathing, and an irregular heartbeat. In the most severe cases, it can cause the heart to stop completely. If you have any degree of kidney disease, you must not take magnesium supplements without the direct supervision and guidance of your doctor. The second red flag is very low blood pressure. We've discussed how magnesium is a natural muscle relaxant, and this effect extends to the smooth muscles lining your blood vessels. By relaxing them, magnesium can naturally help lower blood pressure, which is a benefit for many. However, if you already have hypertension or low blood pressure, Taking magnesium can be like pressing down on the accelerator when you're already going downhill. It can cause your blood pressure to drop to dangerously low levels, leading to dizziness, lightheadedness, fainting, and falls, a particularly serious risk for older adults. The third red flag is a slow heart rate or heart block. Magnesium plays a key role in the electrical conduction system of your heart. It helps regulate your heartbeat. But if you already have a condition that causes a slow heart rate, like bradycardia, or an electrical signal issue known as a heart block, adding magnesium can make things worse. It can further slow down those electrical signals, potentially leading to severe rhythm irregularities or, in extreme cases, cardiac arrest. And the fourth red flag is interactions with certain medications. We touched on some medications earlier, but a few more require special attention. Magnesium can bind to certain antibiotics in the stomach, specifically tetracyclines and fluoroquinolones, preventing them from being absorbed and rendering them ineffective. What science is increasingly telling us is that if you're taking these, you must separate the doses by at least 2 to 4 hours. It can also amplify the effects of muscle relaxants and certain heart medications like digoxin, making their effects unpredictable and potentially dangerous. The consensus among wellness professionals suggests that you should always have a detailed conversation with your pharmacist or doctor about all your supplements, not just your prescriptions, to avoid these dangerous interactions. And there you have it. The full picture of magnesium, not just the good but the bad and the essential rules for safety. We started by understanding the vicious cycle of stress, then uncovered the hidden depleters in our own cabinets. We learned the truth about misleading blood tests and the vital balance with calcium, and explored how to choose the right form for the job. But we culminated in our vital truth number 1, the critical red flags for people with kidney concerns, low blood pressure, slow heart rates, and those on specific medications. Understanding these warnings is the most important takeaway from our time together today, because the first rule of health is always to do no harm. So which of these insights resonated with you the most? Was it the concept of the stress cycle, or perhaps the truth about the blood test? I would genuinely love to hear your thoughts and experiences in the comments below. If you found this journey valuable and believe it could help someone you know avoid a preventable mistake, please give this video a thumbs up and share it with your friends and family. And don't forget to subscribe and hit that notification bell for more deep dives into health for those of us in our prime. Until next time, stay healthy, stay curious, and keep thriving.